Hello, my name is Hazel Gowland and I'm an expert patient and researcher in the field of allergy. I'm working in a team, a task force set up by the European Academy of Allergy and Clinical Immunology. We're trying to make lives better for adolescents and young adults who have asthma, skin disease and allergies. The first thing we need to do is to find out what will be helpful to improve the lives and the care of these young people as they move into adulthood. Here's a photo of some of the doctors, nurses, researchers, psychologists and patient representatives from 10 European countries who've been involved in this project. The first thing we needed to do was find out if there was any good information from other studies done in the past to help us to work out what would be best for these young people. We took the ideas and we put them in a survey and asked the young people and their parents what they think about them. And then we did a double check to find out if there were any more good ideas from asthma, skin disease and allergy experts. And we're collecting together the information that we find. We've discovered that we need to understand quite a few things. The first one is, when is the best age for young people to start to look after their own conditions as they grow up? Then we want to know how their friends and family may be able to help them more to deal with their condition. We'd like to find out what helps them to take their medication correctly, to remember to take it and to take it properly. Many of these people have allergies and we'd like to be able to help them avoid things that they're allergic to, including foods. Sometimes these people will be at risk of having a severe allergic reaction or asthma, and we want to be able to help them better manage an emergency. And sometimes their future plans and career choices are affected by the conditions that they have, and they may need help finding out what they can do in the future. So we're asking how to improve the hospital and doctor's appointments that they have, the consultations. What ways can we use to help them manage their treatment better? Maybe they need reminders. Maybe there's technology that they can use to help them use their medication better. Sometimes young people with these conditions face stress or bullying, which will either make their condition worse or be caused by it. Some young people have indicated that they'd like more help dealing with their family, friends and school to get the support that they need. There are different ways in which the doctors and nurses in the consultations can talk to both the parents and the young adults. We want to find out more about that. And of course, they've got many other questions and we'd like to find out what they need to know. When we have found out what works best, then we're going to develop resources. As children with asthma and allergies grow into adolescence and then young adults, the medical care they receive needs to be adapted to support them. So our plan is to provide information and resources so that these young patients can become independent, competent, expert adult patients. We're developing a guideline to help the doctors, nurses and other healthcare providers give them the best treatment and advice. We're developing short films like this one to explain what we found out, what will be helpful. We're also putting written articles in journals for other medical people to read to find out what works best. And we're developing a toolbox of resources so that Various healthcare professionals and others, you can see a list here, will be able to give better advice and better care to these young people living with allergies, asthma and skin disease. If you want more information about this project, you can have a look at this website on the EAACI website about this task force. Thank you for listening.